Good afternoon and welcome to Have a Chat. I'm Audrey Lynch with my lovely co-stars Judy Loge and Veronique Arsenault. Hello, ladies.
Hello, Audrey.
We're all together again.
Yes, we are. Yes, definitely great to be back. It's been a little while. I missed you guys.
I
know. The Three
great
Musketeers,
friends.
exactly.
I know.
So I was away, so I guess I'm up for the thought of the day, and I was. And I know some people might not want to hear this just yet, but we are 5 weeks away as of today of Christmas Day.
No.
I know. So my thought of the day, I was coming across, I've been home relaxing and resting and recuperating.
I wouldn't say
so
relaxing exactly.
I know, but I've been watching a lot of TV and reading a lot of things and posting stuff on Facebook, and I came across this one and that I wanted to share with everyone, and the heading of it is "Being rude is easy."
Too easy.
Right? Too easy. It does not take any effort and is a sign of weakness and insecurity. Kindness, though, shows great self-discipline and strong self-esteem. Being kind is not always easy. Kindness is a sign of a person who has done a lot of personal work and has come to a great self-understanding and wisdom. So please choose to be kind over being right, and you will be right every time because kindness is a sign of strength.
You know what, Audrey? I feel really good about that
Yeah.
because I'm very kind.
Yeah.
Yes.
And rude's not in my makeup.
I know. And the thing is, the reason I wanted to bring that up now is because with this time of year, and everything being so rushed, and there's so much stress and so much to get done in such a short period of time, and we are all trying to do the same thing to be ready for the same day. It's just so easy to be quick and short
and rude.
and
For sure.
And
Customer
it's
service.
just, I find myself even like standing in long lines and different things like that, whether it's getting my coffee or buying a gift and things like that. But to look at that person and say thank you and have a great day.
Even if they're not, just try to make them feel better.
Exactly.
Well, and
It goes a
people
long way.
forget that, when we're shopping and everything, that the people who are working in retail and hospitality, like they are working long hours.
Worn out.
They're dealing with an increased workload with very little extra help, and it's just it's hard.
It's trying.
It is.
Retail
It
is
really
hard work.
It is.
It's hard work, and so is the hospitality industry.
Yeah.
But I liked what you said, that being kind isn't a weakness. That sometimes it's really hard to be kind.
Do you find? I love to be kind.
But think about it. When somebody is screaming at you or being rude to you or whatever, it takes an extra effort to say, you know what, I'm not going to answer them.
Not to be rude back.
I'm not going to answer them that way.
I know. I kind of I just walk away.
I don't mean in a general, every day to be kind. I mean in those situations where you've got somebody in your face and they're being awful to you, or even if it's not, in the rushed hurriedness of the holiday season. Sometimes people are just nasty.
Yeah.
I feel like they, as being the way that they're being and rude and stuff like that, we don't know what they're dealing with at home and what their issues might be. So being kind to them to spite their rudeness might be all they need to feel better that day. Really.
Fair enough.
Definitely. So that was my thought.
Yes.
Very good.
Wonderful thought. Beautifully said. I just have to run through really quickly some special events that are happening. It's the 19th annual Jerry Cormier Memorial Christmas Concert happening this Saturday, November 25th at 7 p.m. at St. Mary's Church, which is 360 Newcastle Boulevard. It's hosted by Susan Butler. It features many, many wonderful performers. And the list is too long to go through, but you'll be well entertained. Admission is free will offering, and it's going to Jerry's favorite charities. So there's a reception to follow in the basement afterwards. So be sure to get to that.
Yeah.
He loved that concert
I
every
know,
year.
and I miss him.
know.
And for the
Exactly.
Beaverbrook Historic House, they're having their Christmas craft and tea show,
That's
which is
right.
at 518 King George Highway. And it's the first Christmas craft and tea that they've ever put on. This Saturday again, November 25th, at a different time from 11 to 4. Admission fee is $5, and all the money raised goes to the Beaverbrook House.
Wonderful.
Two big events. Two big
Exactly,
events.
and
So
that's
much.
coming up. And the other great thing that's coming up this weekend that everyone's really excited about in my house is Danae. My youngest is actually performing, and her opening night for many of them, the cast of How the Grinch Stole Christmas.
Yay, I'll be there.
That's Friday, Saturday, Sunday, Monday. So the
Yes.
24th to the 27th. Tickets are still on sale for that. So please run out and get your ticket. It
I
was
got my
like
ticket.
full house every single night last year when they
Yeah,
did
can't wait.
The Lion King. It is just
well,
amazing.
we had a sneak peek at the James M. Hill Memorial,
I
Wall of
forgot.
Fame,
Yeah.
where Connor Blakely sang and Jack Forrest performed, and then I don't know the little one's name who played Cindy Lou Who.
Gracie.
Yeah, she was amazing.
Grace.
So the three of them were fantastic. So I can't wait to go.
Yeah.
No, it's going to be amazing.
Yeah.
So that's coming up.
One other thing that night's
here.
happening, the Women of Influence.
Yes, the Women of Influence.
November 25th.
Yes. Oh my God, there's so much this weekend.
So we'll all be there, but just remember, if you want tickets to go to the Women of Influence, they're honoring very many special women in our area.
That's right.
And it's at the Rod this Saturday night, cocktails at 6, dinner following. Then they
awards.
will have tickets being sold at Town Hill Jewelry
Yep.
and the Blush Bar in Chatham.
Blush Beauty Bar.
So dinner's included for $50. Let's get
Done.
on with the show.
There, that's everything that's happening in Miramichi on top of everything else that we have to get done this month. And next we want to invite Brandy Donald to the show.
Welcome.
She's here.
you.
You're a nurse practitioner that's
Yeah.
here to talk to us about the Sculpt Health and Wellness business that you're an owner of, and also a educator.
Thank you. Thanks for having me on. I'm really
Pleasure.
excited to be here. So my name's Brandy Donald, and I am by day, I'm a registered nurse practitioner with Horizon Health Network. I carry a caseload of around 900 patients,
Just
give or take.
Just a few.
Yeah.
Wow.
So I do that Monday to Friday. I've been in the nursing profession for almost 21 years now.
Imagine.
Wow.
You can imagine.
No.
Not
but
possible.
yeah, yeah.
I'm like trying to run the numbers. Jeez.
Yeah, but today I'm here to talk about Sculpt Health and Wellness. And that is a franchise that my husband Ian and I bought around this time last year, actually. It is a health and wellness franchise that focuses on nutrition counseling, wellness education, depending on what a client's goal is. So we work with clients who have all different kinds of goals. So a lot of people come to us for weight loss, maybe just to feel better, overall health. They're lacking energy, they're not sleeping well, they have digestive issues. Some people come to us actually trying to gain weight or muscle mass. Maybe they're training for an athletic event and they think that their nutrition is lacking a little bit, and maybe they need to kind of tweak that
Right.
to increase their physical performance. So depending on whatever the client's needs are, that's basically what we address. And we work on those things, whatever their goals are, one-on-one over the course of usually 10 weeks, but we're pretty flexible. We work within what the client wants to do. Some only want to do 5 weeks, and some will do as many as 20 weeks. So that's basically, in a nutshell, what Sculpt Health and Wellness is.
So a lot of people would think that you're just all you do is get people ready for bodybuilding.
Okay, so that's awesome that you brought that up, because that has been a huge confusion that we've been trying to clarify over the last year since we bought the franchise. And where that comes from is that the co-founders of Sculpt Health and Wellness, Jason Capson and Ryan Reynolds, so this is a franchise. There's, I think, I don't know, like 10 or 11 franchises across Canada now.
That's not that
But
many,
they
though.
have a background in bodybuilding, coaching, personal training, that kind of thing. And they put together Sculpt Health and Wellness to be what it is today, a health and wellness franchise, personal health coaching, that kind of thing. But because of their background, they ended up having a competition stream. And when they first put together that competition stream, they called it Team Sculpt as a branch off from Sculpt Health and Wellness. And then, as time went by, they realized that maybe that wasn't the best idea, because a lot of people were confusing Sculpt Health and Wellness, a wellness endeavor, with bodybuilding, which the two are not the same at all.
No.
So then they changed the name to Team Chiseled. So we have that competition stream, but it's a separate stream altogether. So Sculpt Health and Wellness is for everybody, regardless of age, regardless of goal, and it's not about bodybuilding at all.
Okay, so can you send a 15-year-old child that's still developing in there? Would that be advisable?
Absolutely.
Yes.
Because when my husband and I decided to purchase the franchise last year, the reason that I really wanted to get into it was because of my health training and my health background as a nurse practitioner. I myself did the Sculpt Health and Wellness program, so I knew what it encompassed, and I believed in what the message was. I would recommend it for my patients. I would recommend it for my kids, my
parents.
family, my parents,
yep.
everybody. And what I liked about it was sensible. It didn't incorporate, special foods
Crazy
or special
diets.
things that you had to buy to go on the program. All the foods are whole, nutrient-dense foods that you find in the grocery store. There's no, fancy additives. It's really just common sense. And the biggest thing about it that I liked is it's sustainable. So it's not a means to an end program. It's not like, okay, you come with us for 10 weeks, we'll get 10 or 15 pounds off you, and then we'll see you later.
No.
And off you
follow
go.
up.
And within a month, 2 months, 3 months, 6 months, you fall back into your own patterns. You put that weight on, and oftentimes more. So what we're really trying to do in that 10-week period is work with clients to develop the habits that will sustain them beyond the 10 weeks so that they can make it stick. And it is sustainable. It's 5 to 6 small, well-rounded meals throughout the day, lots of water, physical activity as per the guidelines that are set forth.
Well, just talking about that part of it, does that mean that you would also cross over into, when I think about people who would come to you, especially leaning towards teens and young girls, trying to develop, you would also have some form of training then with mental and psychological that people might be dealing with, in that sense that they have issues with eating or not eating?
They don't like their body image, you mean?
Yeah, exactly. That they're
it's going to depend on the consultant that they're assigned to.
Okay.
So at Sculpt Health and Wellness Miramichi, the 2 consultants are myself, which I have, reams of health experience, and my other consultant is a registered dietitian, well known to the area, Lucy McRae. So
she's awesome.
we have a wealth of knowledge as health professionals first and foremost that we can offer our clients here in the Miramichi. So it's just going to depend on the franchise that you seek out, what the consultants are, because they're not all healthcare professionals, though they each bring something unique to the table.
Right. Because I can see some people coming and then asking for help and then realizing, this is more of a mental issue for this person.
Exactly.
You
know what? A lot of it is mental.
Well, we joke at work all the time because we eat a lot at work, right?
Yeah.
And I always say I'm eating my feelings today,
Absolutely.
right?
But it's just there. Is that why you're eating? Because it's just there.
No,
You're
it depends on
grazing?
the day.
Oh.
It depends on the day. Some days I'm just grazing because it's in front of me, but
Right.
other days it's like, you know what? I'm either really happy and I'm going to eat the
Yeah,
coffee cake in front of me,
emotions.
or I'm really stressed. I'm going to eat the bag of chips in front of me, right?
Right.
But we make the joke. It's almost a daily thing. I'm eating my feelings.
I'm eating
today.
my feelings.
And that is a huge part of it, right? So we use food nowadays, we use food for what it's really not intended for. I mean, it's okay to use food for a celebration of a special event or, to spend, special time with friends and family.
Christmas
That's all
dinner,
fine.
all that.
Yes.
And you should be able to do that. But to turn to food when you're stressed, angry, upset, sad, depressed, lonely, whatever, that's when we get into trouble. So we work on that. And so every week when we meet with clients, we address different kinds of educational topics. And sometimes it's setting goals, working on what your obstacles have been in the past, what are your habits, healthy and unhealthy, and then we devise plan to kind of tackle each one of those.
Okay, we've got to get in your story. Your story as Brandy Donald, the registered nurse that was probably always healthy and fit, I don't know, but let's just take you from your the level you were at, okay, just a generally healthy girl probably, to winning just recently the title of for New Brunswick.
I won the Provincial Masters Bikini Championship, and I won first in the Open Provincial Bikini A division.
So, on that note, a huge congratulations.
Thank you.
Yes.
But a journey you took to get there, self-discipline, working out, eating, like you upped the game to go to that next level. So how did you do that, and how did you stay motivated throughout?
So I was introduced to the whole crazy world of bodybuilding. I say crazy, but I love it.
Okay.
About 2 years ago, Adam Hambrook approached me. He was putting together a team locally, and he approached me to see if I would have any interest in it. And at the time, like you said, I was always healthy. I never had a weight issue. I was always active. Like I'd done numerous half marathons, I've done triathlons, I've done different kinds of physical events, always kind of training towards something or always had a goal that I was working towards. And this was something that kind of scared me, but intrigued me at the same time.
Right.
So for me, if those kinds of things are going on. It's kind of like, you know, a little switch flicks in my brain where I think, oh, this might be for me, because it's a little scary, yet I'm intrigued at the same time.
Set your goal.
Right. So I started training, it would have been 2 years ago, this month actually. I actually started,
before Christmas.
yeah, I actually started training under Kenny Black.
Oh, bless his
yeah,
heart.
yeah. And I did my first competition that was Atlantics in 2016. Yeah. And I placed 5th in the Masters division.
Wow.
Which for my first competition was great.
Crazy.
I felt really awesome about that. And I kind of thought to myself, you know, I think I can do this. I think I can win first in this. And so I just continued doing competitions. I did a lot. I did 6 over about 18 months, which is a lot. But it becomes a little bit of an addiction, and especially each competition I did, I got a little bit better placing.
Exactly.
A little bit better, a little bit better. You know, I could see the changes.
Right.
I could see the changes, and it was paying off. And so this year I just was kind of like gunning for first, and
Totally
I thought,
devoted.
you know, I'm gonna do it. This is gonna be my year.
The message is you can do whatever you want with the right mindset.
Oh, absolutely.
Anything's achievable if you're determined.
It's
to
all
do
up
it.
here.
It is.
Yeah.
It is.
Yeah.
Despite all of your background that you had with health and wellness, it's still, you know,
A
a
huge
struggle,
personal
a huge
commitment.
struggle.
Yeah.
Like, I mean, here
You
I
don't feel
am.
like it
You know what I
made it
mean?
easier for you
I'm not
just
that
because.
young. I'm in my 40s.
Yes.
I have 2 active boys with active schedules. They play competitive sports. My husband works full time. I work full time. We own our own business. I see clients on the side in the evenings, and it was something that I wanted, so I made time to eat the diet that I had to eat and prep my food ahead of time and bring my food with me and
Discipline.
you
put
know,
the
all
hours
I-
in at the gym.
put the hours in,
That's
you
the
know,
other thing.
towards
That food prep is a big part of
that's
it, right?
a huge part of it, and we
Yeah.
teach that with Sculpt Health and Wellness, that you want healthy food to be convenience food.
Right.
So if you come home from work and you're tired and stressed and you had a bad day and there's nothing to eat, you're going to go to something that is quick and
Nuggets or fries or
convenient,
something, yeah.
or stop on
Yeah,
the way home at the
exactly.
drive-thru or whatever. That's
Right.
life. But if you know that there is, you know, cooked chicken, rice, salad all ready to go, you're
Yes.
probably more likely to go home and grab that,
Yeah.
because
Great.
you know, really, once you eat and it's done, you feel
done.
fine.
Yeah.
You're not worrying about, you know, the drive-through anymore.
Yeah,
It's over.
exactly. So it just makes it so much easier to attain your goals. We want to thank you so much for joining us.
To get to her, do you
Oh,
have
yes.
a number, a phone number or location
Yes.
right now?
Okay. So we are located. We just switched our office. We are now located at the Glamour Building here in Newcastle.
Yeah.
I think that's Henry Street, I
Okay.
believe. Might
Okay.
be 65. I'm
Great.
not 100%
And I'm sure you have
sure.
a Facebook page as well.
Yes,
Okay,
we do on
perfect.
Facebook, and you can contact us through our Facebook page. We're also on Instagram.
Okay.
And,
Perfect.
Great.
Yeah.
If you want to
Congratulations.
check her out, look it up. I believe it's Sculpt Health and Wellness. We'll be back after the break with more Have a Chat. Don't go away. Welcome back to Have a Chat. We were just chatting with Brandy Donald, and she was a great guest. Talked a lot about health and wellness. We had to scoot to break really quick, so we want to make sure that all our viewers got that information on her Facebook page.
Yes.
The Sculpt Health and Wellness Miramichi is how you find it, and you can easily message there to get the information you're looking for, to find out their location and how to get any part of that and be involved with that
Great
if you're looking
service,
for it.
consultation
It is.
on your body,
It
your
really
health
is.
and wellness. They'll help you all the way.
No.
Well,
I
it's
think
amazing what
great.
she's accomplished too
Oh,
in the
that's
last
what I
couple of
mean.
years.
She
Yes,
just, you know,
exactly.
And she said it really clearly. She's just as busy as the rest of us.
That's right.
Super busy.
No,
It's just what you
exactly. And if
decide
that's a
to-
goal that you want to attain and you put your mind to it,
It can be done.
It can be done,
Yeah,
exactly.
proof is there.
We want to welcome Sarah Trevors and Francisca Votor
Hello,
to
ladies.
the Have a Chat show. Thank you, ladies, for joining us today.
Yes.
You are a nurse practitioner?
No,
Nurse?
I'm a registered nurse.
Registered nurse. Yes, I'm
Certi-
getting her confused with Brandy already.
Yeah, it's certified. And I'm a certified diabetes educator as well.
Yeah, and you are a
registered dietitian
Perfect.
and a certified diabetes educator.
Yeah. So we'll start off first for you to tell us a little bit about yourself and who you are.
I'm Sarah Trevors. I'm originally from Miramichi. I'm born and raised here in Miramichi and have a family here as well. I have 2 girls and my husband, and we seem to be quite busy as well. See a lot
I
of
don't
people-
think there's ever a dull moment.
Full-time job.
Yeah, work full time at the clinic.
And Francis.
And I'm, a mother of 3 girls. And I'm originally from Niguac, and I'm still living there.
Nice.
So that's where I grew up. And I've been working at the diabetic clinic for at least 11 years.
Wow.
But I've been practicing for at least 22 years as a dietitian.
Wow.
Where is this diabetic clinic located?
So we're located in Chatham, and it's the Blanchard building in Chatham.
AC Blanchard.
AC Blanchard, 10 Hotel Deer Street in
Right,
Chatham.
right.
Just in front of the mount.
Yes.
Just in the back parking lot,
at the end of the
Oh,
mount.
okay.
Yeah.
Yes,
Yeah.
yes,
Or
yes.
behind
That
NBCC.
little,
Yes.
that
Yeah.
little, I don't know what that little street is called.
But we
I
did
know.
want to have you on because diabetes is a huge topic.
Yes, yes. We actually have 4,000 active patients at the clinic.
Wow.
Those are
Miramichi?
active patients
Wow,
that we
that's
see.
just-
So it's
you're
huge.
kidding.
And those aren't all the diabetics in the Miramichi zone. Those are just the ones that we actively see.
Active is right.
Yeah.
Yes.
So Miramichi and surrounding area.
Yes.
Yeah.
Yes.
So our clinic, we service like the whole Zone 7, which would include Niguac, Bay St. Anne, Rogersville, Blackville, and we go to Eel Ground and Burn Church as well.
Busy, busy.
So we
busy.
travel out to a lot of those. The only one that we don't travel to right currently is Bay St. Anne, but all the other health centers we travel to those at least once a month, and some we do every second month. In Burn Church, I go to Burn Church every
Your
second
team,
month.
you usually
Yes,
travel
but
together?
we're 4 nurses and
Okay.
2 dietitians.
Oh, wow.
And there's 2 nurses and 2 dietitians that goes on the road, but there's also 2 case managers. They're RNs, and they work within the doctor's office.
Okay.
So we're out there.
So diabetes being so prevalent, could you distinguish between the different types of diabetes? Diabetes 1 versus diabetes 2, for example?
Yes, so there's actually 3 types.
Oh.
So there's type 1, which is the least common. Only about 10% of the population have type 1, usually diagnosed under the age of 40. Usually it used to be called juvenile diabetes. So typically when you think of a type 1, you think of a child, but it can happen later in life. Like we've had people that have been in their 60s, 40s that get diagnosed as a type 1. They have no insulin production right away. So they get sick very quickly. It comes on suddenly. They're usually admitted to the hospital with diabetic ketoacidosis, which means that their sugars are really high, they're vomiting, upset stomach, and they don't feel well when they come in. They typically lose a lot of weight, and then they get admitted for that and go on IV insulin. That's typically how we get those new
Type
diagnoses
ones,
of type 1. Type 2, usually diagnosed over the age of 40. It's the most common. 90% of the population have type 2 diabetes, usually over the age of 40. If you hold more weight around the center,
Yes.
to a more obese person, and
Typically
family.
typically
Lifestyle
self-induced,
related.
I guess. Is
Not necessarily. We
Okay.
have some type 2s that are quite lean as well. So you never know. Usually we look for extra blood work. If it's a lean type 2, we're like, this doesn't really match.
It's not the typical.
It's not the typical. So you can see a lot of different cases, and no case is ever the same.
No.
Yes.
So,
And then you said there's a third?
and the third would be gestational diabetes. So one that you develop while you're pregnant, and then we do screening afterwards to make sure that you don't stay as a type 2 afterwards.
But one that we see a lot now, we used to call it the borderline, but now it's no more. Like it's an old term that we used to use. Now we have pre-diabetics. So we do even the prevention phase before becoming a diabetic. A lot of them are diagnosed with pre-diabetes.
Okay.
So it's almost like four
almost
types. There's the
like-
pre-diabetics before coming to diabetes.
Trying to catch it before they
So we're even
turn into one of
servicing
these.
out classes to the pre-diabetics. So we have a lot of referrals from the doctors early on, diagnostic of that pre-diabetes. So we try to prevent for them to become diabetics early. Not in 6 months from now, but maybe if we can delay it. The more we can delay it, it's the best way to do the prevention.
So the viewers should know right off the top, what is diabetes?
Yeah, so I think I'm gonna, because this is actually, I'll pass these around. This is what we would use at our classes. We use this map, conversation map.
Yes, it's
So-
living with diabetes, and there's different sections of it.
So
Okay.
if you
So
just
if you
want to
just
look
show
at
lives-
this
like this.
section here,
Yeah.
yeah.
Because people hear
you
about
talk
it
to it and
every
I'll hold
day.
it.
You have 4,000 patients with it, but for those people that are sitting home watching the show, they might not exactly know what is diabetes.
Yeah, so when you look at this map, if you were to come, so we offer a class once a month. It's offered in English. We can offer it in French as well. We've never really
On the demand.
to have a full French class.
We
could
do the
it
pre-diabetics
the pre-diabetic
in
class.
French and English.
Good.
And we travel out to Rogersville, Nigwak, and put those classes on as well. But this one here is one that we do at Sobeys once a month. It's the first Friday of every month. So any new diagnosis or anybody that hasn't been in for a while, they come to the Sobeys in Douglastown, and we offer this session. And it runs about 3 hours.
In the community room.
In the community room. So this map, when you look at it, right down in the left-hand corner, it says diabetes is a disease in which the body does not make enough insulin, the insulin does not work properly, or both. This can cause the amount of glucose, or the sugar in your blood, to rise to higher than normal levels. So that's exactly what we would cover in this class.
Yes.
Then when you want to dive in a little deeper, if you look on the sidewalk here, it says insulin, pancreas, blood glucose, liver, fat, and muscle. So I sort of brought these cards. So if you guys want to pass a card around, and we'll just go through, and then you'll really
there a test
understand.
when we're
I
What we do basically in the class. So when you're in the class, this is how we learn.
Yes.
This is how we interact, and this is how our patients are really learning from others.
And the
they don't
information
feel
you're
the
giving
only
them
one
is
there.
staying with
Yes.
them because
Yeah.
you're handing them these.
So we're
Yes.
doing a class type
Okay.
thing right
Yeah.
now.
Okay.
So if you want to read one of the cards.
Sure.
Or
Daryl?
Okay, so defining diabetes, the amount of glucose or sugar in your blood.
So then if you look at the sidewalk, you have to match that up to the one
Oh,
that's on
okay,
the
right,
sidewalk.
okay,
Yeah.
yeah, okay.
So you said it's the amount of sugar in your blood.
Right.
So what would that line up to be?
would that be blood glucose?
Yes.
That's right, yeah.
That's it. So you got it right.
Yeah.
Okay.
So Judy,
Defining diabetes cards. Okay, these types of cells need insulin in order for glucose to enter them and get the energy they require to work. These types of cells. Okay. I don't know. Cell,
Is it in
cell,
the
cell.
Yeah, it's in
Yes,
the
the
sidewalk.
It's in the
Yeah,
sidewalk.
yeah, it's
So
one
you
of
have to
the-
pick there.
Your cells. Is it fat cells?
It would be your muscle.
Your
actually.
muscle.
Okay. Yes,
So
okay.
if you don't have, if the sugar, when you have diabetes, the insulin has to go into the cells, opens up the doors for the glucose to come in and use it up for energy. So if you don't have any insulin, the sugar can't get into those muscle cells for it to work properly.
Okay.
Yeah.
That's
because
really
our first source of energy we burn, right now we're burning sugar. So we do need sugar in our
Yep.
diet, but we need to control the amount. But we need our body to function well. You know, for insulin, it's the hormone that goes and gets your sugars to be used by your cells.
Yes, because sugar is an issue. Too much is an
That's it.
issue, and not enough is an issue, right?
But you see people with their sugars right out of control.
Yes.
And then we'll talk about the aftermath of that, what is caused when they almost overdose with sugar.
Yes. Okay. So my card says a hormone that carefully controls the amount of glucose in your blood. It helps your body's cells take in glucose from your blood to be used for energy and helps store excess glucose. So that's the insulin, isn't it?
That's right, yeah.
Okay.
That's really good.
So that explains the function of how important it
Yes.
is.
But in our class too, just doing this, it teaches you too how our body works. Because often when we don't know how our body works, we don't understand. So try to get the reason why our body is working like that, and for people to understand, that's why our sugars are rising up in our blood. You
I
know?
understood, for me, just right off, if someone was to ask me without going through this right here now, what diabetes was, and I would be like, one is too much. This type of diabetes is one has too much insulin and the other one is not enough.
Well,
Is that
actually, they
correct?
both end up to be the same.
Oh, they do?
So
Okay.
type 1, you have no insulin production right off the bat. Like as soon as you get diagnosed, your insulin production is almost down to 0. You can go through a honeymoon phase where your pancreas can start to work back and forth for up to 2 years after you've been diagnosed.
Oh, really?
Type 2 diabetics, they have insulin production, but every year you produce less and less. And in the end, after so many years, whether it's 3 years, 4 years, 10 years, 20 years, you have no insulin production as
The
well.
wear
So
and
it's,
tear.
it's more of a gradual.
Because it's a progressive disease.
Okay.
So we're trying to work along with the patients to get the prevention and to delay that progress.
Okay.
It can be very scary when the diabetic situation is out of control. What are some of the situations that can occur if somebody is not looking after themselves? For example, eating a lot of sugar and not doing what you're telling them to do.
Yeah, so we don't really ever limit anybody on their sugar content. You'd be surprised. We don't really look to say sugar.
Okay.
Francisco's more the dietitian here,
Yes.
but we look at the carbohydrate intake.
the
Okay.
not
carbs.
just the sugar.
That's exactly.
And finding a balance into your nutrition. Not only carbs, the carbohydrates is one aspect, but there's protein, there's fiber, your vegetables, your fruits, all your
Grains.
food groups.
Yeah.
So we really look at all of that. So when we teach our class, it doesn't last an hour, it lasts 3 hours. So we do the aspect of the map and we do different sections. The physical activity comes part, the medication, understanding why the medication are there, understanding why physical activity and the nutrition. So it's all a complete balance of all that we teach. And we don't teach them dieting. It's not diet. We're teaching them how to eat right.
Proper.
And it's like when you're a kid, you start riding your bike the first time, you don't get it right. The same way as trying to eat right, it's teaching them how to eat.
Yeah.
And
Yes.
this is, I don't talk about dieting, that's not even a word.
Okay.
But it's just learning them, and it's not going to be the first day you're going to get it. It's bit by bit, the changes you're going to do, then you're going to keep, it's becoming your lifestyle.
Because
So
people
learning
don't
to eat right,
realize
yes.
bread has so much sugar.
Oh, yes.
Like they don't realize it turns into
Well,
sugar.
the
basically.
carbohydrates turn into sugar. That's exactly
Exactly.
it.
Yes.
They think sugar that you're
Yeah.
talking about, the blood sugar, has strictly to do with the white powdery table sugar.
And a,
No,
lot,
no.
and a lot of people just read the sugar on a label. They only read the sugar
They don't
content.
take
They
into
gotta look at the
consideration
carbs.
carbs as well.
Because there's carb, there's fiber, there's starch, there's sugar,
yes.
but all together it's the carbs that you have to look at. And
See,
a lot
no,
of
I
people
find
don't
this
even understand that a
amazing.
slice of bread has 3 teaspoons of sugar. The same amount as a cup of milk has 3 teaspoons of sugar.
Yeah, I was
So it's
surprised by
teaching,
milk.
it's teaching them that every food can fit, but in moderation.
That's
yes, yes.
So the key, that's where we're trying to get the message, like, because a lot of people are like focusing on the no carbs. We don't really promote that because basically our first source of energy we need is carbs. We need to control the amount that we eat and balancing your meals. The protein, the carbs, the grains, the veggies, vegetables are part of our nutrition that a lot of people are lacking. They're lacking their dessert as being a fruit is your dessert. So we're looking at the whole picture of eating right, fitting your meals,
because that
So-
fruit is laden with sugar.
Oh, yes.
It's just full of
Yes,
sugar.
but it's still part of your nutrition.
I know you need so much.
because
Yeah,
it has the
that's it.
vitamins, it
Realize.
has minerals,
That's
it
it.
still
It's
has
only- yes,
healthy
that's it.
attributes to it.
Yeah.
And
What
I
find-
always promote, eat your meals, don't drink your meals.
Yes, exactly.
Okay.
Like
So
no
that you can
liquor
get
at
the
all.
fiber.
We
Now that's a different
no,
show.
but part of the diabetic teaching, we still talk about alcohol because
Yes,
a lot of patients don't
that's
even
right
know.
too.
A lot
They
of
don't
sugar,
realize
yes. Okay.
exactly. What I found strange, and because I had no interest in learning a whole lot about it, because I truly didn't have anyone close enough in my family that was affected by it until recently, and I still in my head found it hard to wrap my mind around it because my father's 75, over 75, and has just been diagnosed, and I'm like, that doesn't make sense to me because he was so much older. But he said that he's always been, his doctor had told him, he's always been borderline.
Pre-diabetics.
So I was like, okay, but all of a sudden now you're full blown. I don't know how it just
He
tips
could have been
over.
there for 10 years, maybe delayed it for 10 years.
And that's what my father said. He felt like his doctor has told him that for a while.
yes, so.
Right? Kind
Oh,
of
we
thing.
get-
So now
and-
he's getting this information in the class when technically it should have been sooner.
Oh, because
correct?
that's why now we do the pre-diabetic. The diagnostic are being done earlier, so we're
Right.
doing some prevention. So we're doing pre-diabetic class and diabetic class, but we just hope when we see our pre-diabetics, we don't want to see them 6 months from now. We want to see them maybe 4 or 5 years
Right,
after.
right.
No, was that bit a bit?
Because what we teach in a pre-diabetic class is the same thing as in our diabetic class. We teach them
Right.
the same way of life.
So would his doctor have or does he just pick up the phone and call himself? Or
You
how
can,
would he
as
get
a, as
referred?
Sarah can go over that. You know
Yeah,
how
so
to
we
refer.
You can self-refer yourself to the clinic. You just have
Okay,
to call.
if you
Our,
want
our
it.
number is 627-7500.
Mm-hmm.
So anybody can self-refer. You can be referred by a family physician or any
Okay.
healthcare professional. So,
very
and then we
important to
have
know.
some people that just drop by. Oh, hi, I heard about
Yeah.
you guys. I'm looking for an appointment. So they are booked in. So we
Mm-hmm.
book people that suit the class. We would book them for the class. I mean, if there's somebody that has a hard time to hear, they wouldn't be able to sit for 3 hours. We take all that into consideration before we would put somebody in a class. We see patients individually. So a first individual appointment would run an hour and a half. It's 45 minutes with the nurse and 45 minutes with the dietitian. And we cover different topics, but
Right.
for all the diabetes education, you need to see both. Then we see them as follow-ups every, depending, I would say if you're doing really well and you get a year follow-up, then things are well. If we have to see you every month, then maybe things aren't going quite as well, but we want to follow you a little bit closer, and it's a 30-minute follow-up appointment, either with a nurse or a dietitian. And then Roslyn Duga and Jacqueline Savoy, they're the case managers. So they also see patients out in the family physician's offices. So if you go, say your family physician is Dr. Gerard Loge, she does work there as well. So she sees patients every half hour, every hour, depending if they're new or as a follow-up. And Jacqueline also sees patients, like she travels actually, I think it's one day a month to Eel Ground, and she also has open appointments there with Dr. Melissa McQuaid, and she sees patients through there. And they're in, I think the majority of the physicians, I would say they're probably in about 30 physicians' offices as well. So it's, you can see us in different locations. It's the same service offered everywhere. So we always
certified
review.
diabetes
Yeah.
Go ahead, Vera.
Well, so my question is, like, for a self-referral. So so if someone is overweight, do I say to myself, okay, I must be pre-diabetic, I need to go see you?
But the blood work would show. If you would have a blood work, your doctor would say, okay, I'm a the pre-diabetic is depending on your fasting blood work. If you're between 6.1 and 6.9, you're a pre-diabetic. Once you reach the 7, then you cross the zone that you're diagnosed as a diabetic.
Because diabetes always scared the life out of me. I'll be honest.
Yes, it's a
more than heart attack or whatever.
It's a silent disease.
Yeah, because I had a dad's sister was a diabetic her whole life, like self-induced, we'll say. And so I was worried about it, right? But every time I have my blood work done, I'm actually very healthy, like in you know, so
Diabetic free.
yeah,
Yes.
you know, all of my blood work for everything comes back very, very healthy. So
So
I'm
if
lucky.
you call the clinic and said, I wanted to self-refer myself, once you refer yourself, then we can actually access your blood work. But we can't access your blood work unless you
Yes.
refer yourself.
Okay,
Or a
well, we're
physician
going
has
to
referred
hold that thought, and we're going to take a short break, and we'll be back with more with Sarah and Francesca after the break. Don't go away. We'll talk a little bit more. Welcome back to Have a Chat. If you're just joining us, we've been chatting with Sarah and Francisca, who have joined us today to talk about diabetes. So we had gone to break. Where were we? In the middle of?
We're still talking about the class that we do, Living with Diabetes.
That's right.
So in that class, we cover a lot of stuff, but a lot of stuff is the myth and facts that we encounter in all our patients.
Right.
And even any of you guys often. And what we do in their class, we'll pass on a few cards, and you guys can read a few.
Sure.
And then we can identify if it's real or if it's just a myth.
And we'll
That's-
guess.
Okay.
Can
Yes.
we guess if we think it's a myth or
See, I
a
knew there was
fact?
going to be a test.
Okay, so let's start with Audrey,
Okay.
and you
So
can read your card.
you
and
have to guess myth or fact. Is that what it
Yes.
is?
We'll
Okay.
guess.
Type 2 diabetes can often be silent disease and have no signs or symptoms.
Yes. Fact.
That's a fact. You
Good.
got it right.
That's
Okay,
right.
we got
Yes.
it right.
Because often we have patients that comes in, they don't have any sign and symptoms. You could be, any one of us could be a diabetic walking around not even knowing that our sugars, because our blood sugar, our body adjusts to having our high blood sugars. There's no pain. I wish there would be pain over
So
sugars
only
over
a
8.
blood work would
You're not
tell you.
lethargic.
No, but even
or-
just checking it, I have patients
Oh,
coming
doing
in
that.
and we check their sugars and they're 22 and they feel great.
What is the normal range? So my sugar should be ideally at what?
So a non-diabetic, you would want to be fasting between 4 and 6, and for a diabetic, you'd want to be fasting before 4 and 7.
Okay.
And 2 hours after a meal, you'd want to be less than 10. And if you have a random glucose, anything over 11
Yes.
would diagnose you as a diabetic as well.
You take a kit home and do your own sugars? Can you check yourself?
You could check yourself.
but we don't really recommend that. Often it's through your blood work. The blood work will show it.
Okay.
But once you're diagnosed as a diabetic, your normal blood sugar should be, between 4 and 7 before you eat.
Yep.
And after you eat, between 5 and 10 because you're absorbing your food.
Right.
So we often ask our patients to
numbers
check
don't really
before or
fluctuate
2
that
hours
much.
after.
Mark it down. They should
You're
mark it down.
absorbing your food, so it's a little bit below 10, 2 hours
Okay.
after, and below 7 before meals.
Interesting. What you got, Veronique?
If you have diabetes, you can't drink alcohol.
Myth.
That's a fact.
It's a myth.
It's a myth.
You
It's
can have
a
some
myth.
alcohol.
Yes, you can have alcohol.
Okay.
Giddy up.
It's in moderation, just like
Yes.
everything
Yeah.
else. So for a woman, it's 1 to 2 drinks.
Yes.
And for a man, it's 2 drinks daily.
Okay.
Yes, you can't accumulate them for the weekend.
Yeah. So
I often have that question.
Save them up for the weekend. But I know, but some drinks are like, say, a cooler, a glass of wine is way way,
Yes.
listen to me.
Yeah.
I sound like my children. Is a lot higher in the sugar content than, say, a vodka and soda water.
Yes, that's
Does
it.
that
It's whatever,
matter?
It's whatever you mix with your drinks with.
That's
that you gotta
right.
be careful with.
Like with
Okay.
Coke.
Like
Yes.
Coca-Cola.
But you would still be allowed a
Yes,
glass
still.
of wine
Yes.
or
Okay.
a
That's
cooler.
good, though.
Yes.
But
Or
could I
mixed
have
drink.
more, say, vodka and soda water
Audrey's trying to find a workaround.
to her glass of
But every-
wine? I
yes.
can have more.
You could, but it's
Technically?
still 1
Okay.
to 2 drinks because
Okay.
the alcohol has the effect on your liver.
It's
Your
okay.
liver has functions. So when
Right.
your liver's
Okay.
drunk, he's not doing his work.
Those enzymes.
Right, he's having a nap.
Yes, that's it.
Your liver in diabetes usually
Is a big thing.
gives off excess glucose overnight. So a lot of type
Right.
2s, when they wake up in the morning, their sugars are high, but it's because your liver produces extra glucose overnight.
Oh, there's
So,
something
like
When you
Francisca
drink.
said, it gets
when you
drunk.
drink.
What part
Okay.
does your
When your liver
pancreas
gets
play?
drunk.
What
So it
part's the
doesn't know
pancreas?
when it should turn on
Yes.
and turn off. So a lot of people, when they drink alcohol, you can have low blood sugars. It's
Up
the
to
effect.
15 to 18 hours after you drink.
Oh,
It's the effects of the
wow.
alcohol.
Yes.
The
Because
mix, whatever you mix it with, will have the sugar
Yes.
content, but the alcohol itself can cause you to
It
have
has-
lows.
So overall, we
Precautions,
usually recommend
okay.
to have a snack if you drink,
Okay.
mainly for diabetics to make sure.
Snacks
Okay.
are good.
Myth or fact? Eating sweets or sugar causes diabetes. Myth?
Causes
I
it?
say
Myth.
myth.
It's a myth.
It is a myth. Okay.
Because after Halloween, everybody would be diabetic.
You know what?
It's
In,
really-
in my office, yes, because we ate Halloween candy for 2 months.
But really,
Okay.
it's not the eating the sugar that, it's just the pancreas not producing enough insulin for the insulin to go get your sugars to be used by your, by your cells.
That's-
So it's not what you're eating, that's causing. Weight can play a role because you get insulin resistant. As you gain weight,
Right.
your insulin is there, but it's not used well. So it's
Okay.
just floating around. So as
Stored.
you lose weight, you get a better sugar control.
So your
as you
pancreas
gain
is
weight,
not
your sugar
doing
goes
what
up.
it could.
Okay.
It's not working at optimal level.
It's producing insulin, but your insulin's not used well. It's just
Okay.
floating around in there.
Makes
It's
it very
insulin
good.
resist. We call it insulin
okay.
resistant. So that's why as you gain weight, your sugar goes up. As you lose weight, your sugar goes down. You're still a diabetic. You're diabetic for life, but you can become a controlled diabetic by losing weight.
People often talk about thirst. They say one of their
Yeah.
signs and symptoms
Yes.
is
That
that
they're
they
When
can't
your
thirsty
see
all the
sugars
time.
are running high, those are all signs and symptoms of hyperglycemia, your high blood sugars. So those are signs that we see: urinating a lot,
Okay.
thirsty,
Thirsty.
cranky. You get all those mood swings. You get a lot of things that affect when you're having high blood sugars. So we do cover that in the class too.
Okay. What do you have for questions?
With mine, my next one is there's no such thing as borderline diabetic.
That's a myth.
And
There
you
you go.
We
guys,
just sort of previously talked about
Yes.
that. We did, but yeah.
Okay.
So there's no such thing, and they always say either you're pregnant or you're not. So either you have diabetes or
Yes,
you're not.
the same
so
way.
whether your fasting is over 7, then you're diabetic. Because a lot of the doctors used to say, it's just borderline, just watch it, just
yes, your
and
sugars are
then
6.5, they're 6.8,
Just
but
watch.
now it's pre-diabetes.
So-
We have a name for it instead of saying
Right.
borderline.
Alrighty.
But there's still doctors using that
Yes.
term. So,
Okay.
Yes.
We should
but
teach
we
them.
usually teach them in the class. We can let them know.
Yeah.
Diabetes tends to skip a generation within a family.
I think that would be true.
So that would mean that your parents would have it, you wouldn't have it, but your kids would have
I
it.
believe that. Is that true?
I think that's a myth.
That's
It's
a
a
myth.
myth.
I think
That's
anybody
it.
can
I
get
would
it.
have thought
Anybody
that
can get it.
because there's some in my dad's side, but nothing like what I'm saying? Like
Yeah. So typically it stays in the family. It wouldn't skip one generation then go to the next. So, if you look at all your aunts and uncles and your grandparents, if they all have diabetes, your risk increases with that as well.
okay, very interesting.
Is it hereditary then? If it is.
Hereditary disease. If your blood glucose returns to target levels, you are cured of diabetes. No.
Myth. No. Once a diabetic, always a diabetic.
That's a myth,
you,
right?
you can at least say I'm a controlled diabetic.
Okay.
So,
Sounds cool. I'm a controlled diabetic.
I got this. I got this. You
I
can-
got it.
I don't want to be a
No.
I don't want to be
Nobody
a
wants to
diabetic.
be.
I don't want to be controlled or pre or anything.
People with diabetes are able to eat the same types of food as people without diabetes.
I would say that's true.
That's true.
This is
And it's
moderation,
true.
right?
The key is moderation.
It's
It's
Moderation
how
is the
much
key.
of
It's
that.
learning how to eat right. You know, and in our class, that's what we cover too. A lot of people say, why do I need protein? Why do I need fiber? But in our class, we explain the why. So once they know the reason why, they understand it to do it, Because a lot of people don't know where is protein, what are proteins, where we
What
find our
they
fiber.
actually do for
so
the
once
body.
we teach them in the class, they kind of have an understanding.
Yes.
Can you? Go
And
ahead.
even like if it's your birthday, you're still allowed to have birthday cake. Like you
Yes.
tell them.
Right.
And I do
Yeah.
teach them, if you treat yourself, you treat yourself. But we're teaching them how to treat yourself right and get back,
Like I can have the birthday cake on my birthday. I
And-
just can't have
and-
birthday cake every day.
And that's it. It's
And we
living a
prefer for you
normal
to have
life.
we prefer for you to have your dessert with your supper.
Right.
Yes.
Because that's when you're going to have your protein at the
Right.
same
Yes.
time.
Right. 'Cause
So the reason why, so in a class, we do explain what the protein does to our body. Eating protein keeps us going from meal to meal without being hungry because it takes a long time to digest. But also protein slows down the sugar absorption. So knowing that if you want your sugars to be controlled 2 hours after your meal, you got to have protein on board. Protein in your meal, but protein in your snacks. So we teach them that. We teach them that. So it's a lot to learn, but we don't learn it all in the same day, but it's bit by bit. We put it all together and we see them after the class and we see them individually and we keep at them.
So do you find, I find some of my friends and neighbors that have a family member affected with diabetes, they'll bring in their lemon meringue pie and they'll make their homemade cookies. And to me, that's torturing the person that can't have it other than
But
a one
everything
cookie
is a
now and then.
moderation. It's like setting a routine. If you allow yourself to have treats every day, it becomes a bad routine.
Yeah,
so you
I
got to
know.
get away from that routine and says, yes, there's going to be a wedding. Yes, there's going to be a Christmas supper. There's going to be events.
Yeah.
But you're going to plan your week. You're going to plan that.
But if it's always
So-
in the house, like if
No,
you have
that's it.
5 kids that are bringing in chocolate bars, and the
We
mother's
call
making
that
chocolate
the
chip
comfort
cookies,
food.
that's
So
too
you take the
tempting.
comfort food out of the house. You can
Yeah,
have them,
I would suggest
Yeah.
that.
but you can't have them. in the
Well,
house.
that's a temptation. It's a hard one.
No. Plus, I would think you can change things around. I just last night made my
Teamwork.
first batch of Christmas frogs
Where are
that
they?
I make.
Yeah.
They were coming on. I wasn't going to bring them with me. I thought I might get a growling. But what I did, just for fun last year, was I went through the recipe and I cut the sugar in half. The recipe calls for
Just
2
for fun.
cups.
Always, yeah.
Just for fun.
Just for fun, just to see if they'd eat them. I didn't tell anybody. I took 2 cups of sugar down to 1. I took the sweetened coconut, the 1 cup.
Yes.
It's I put a half a cup of unsweetened with a half a cup of, and that was I made them and they ate them as if they knew
you
nothing.
go.
And it's still a treat, but you're not going to offer them that every day.
No,
so that's what I
exactly.
mean. So we want a lifestyle that it says what's realistic. If you have your sweets every night for supper, then you're keeping the bad routine.
No,
You gotta get away from that.
Well, what about the fact that she said I can have a piece of birthday cake on my birthday, but not every day.
Yes.
But also at the same time, you can't have the whole cake on
No.
your birthday.
No.
Every good
Right?
thing has a moderation.
Okay.
I could.
We all have birthdays.
Like she said, you can't save it all up for one day.
I didn't say I should. I said I could.
I did help you. Oh, do you have any left?
Yeah, I have another one. Natural sugars do not raise blood glucose.
Natural sugars.
Natural,
do
like
not-
in the
Like
fruit?
an apple, like
An apple,
a
okay.
cup of milk, like your bread. What do
Well,
you
I would think the body doesn't
I was
know the
surprised by
difference.
milk. I'll be honest, because I have
There's
always
natural sugar in bread.
always
There's
had a
natural
lot
sugar.
of milk, and I went to the skim milk because I was thinking, well, I'm
The only thing that changes from homogenized milk to skim milk is your
the
fat,
fat.
level.
yeah.
The sugar stays the same.
I don't
I
like
was
milk.
shocked. Oh, I love it. I could drink it all day, every
I
day.
could throw up when I look at it.
No,
But
I
I
actually
make
switched
myself
to
drink
almond
some.
milk.
Portion control. A cup is a portion,
Yeah, right,
and you're
which
allowed to
is- yeah.
have 2 to 3 drinks a day, so 2 to 3 cups a day.
Yeah.
So you can have them with your meal. It's
Yeah.
better to have it with your meal
I
than just
used to
drink in
drink
between
2
meals.
liters a day.
What?
When
So
I was
that's
young,
it.
yeah. When I was
Yes.
young, I drank 2 liters a day.
And that's common. And you
Yeah.
should see when they,
Now I will
when
have
they say a glass of
one.
milk, they're like, okay, that's 2 cups.
Yeah.
Cut down to 1
Eggnog
cup.
time
So
is
every-
coming. Now
That's a
So
treat.
portion
that
control
is-
comes in aspect.
Oh, yeah.
That's gotta have
Okay.
sugar.
These
That's the
types
other
of
one.
is what?
That's not the myth, in fact.
Yeah.
The blue ones.
Oh, the blue
We're
ones.
doing the myth.
There you go.
Okay,
Myths and
myth or
facts, yes.
fact? Type 2 diabetes is a mild condition. No,
Mild.
myth.
Type
That's a
2?
myth.
I'd say
It's not a mild.
That
is
would
it?
be a
That's
myth.
right, it's a myth. A lot of people think that type 2 and type 1, they'll always say, oh, we hear them in the office and they're in the hallway. Oh, you must be really bad. You take how many injections? Oh, you're on 4. Oh, you just take pills. Oh, you just.
Yeah.
But in reality, it's the same disease. Whether you're on oral agents, so oral medications, or insulin, it's the same
It's a serious disease.
complications in the end. And so the complications for both are very serious.
Right.
Like
Yeah.
eye disease, like you can go blind.
I know.
Yeah, retinopathy.
If you have 1, can you get 2? Can it transition to
No.
2? Or
No.
1 is 1 and 2 is 2?
That's
They
right.
can't.
They don't.
You can't graduate to the next
No.
one.
No,
No
it stays
graduation
the
there.
same.
No graduation.
There's a
And
lot of-
kidney disease, heart attack, and stroke are very
And you can
common.
lose lose
limbs, yes.
right?
And we do actually have now, we have Tracy Fournier, she's the wound care nurse at the hospital, sorry.
She's part
She
of our team.
is part of our team now as well. And we have an infectious disease doctor from Moncton, so Dr. Gordon Dow, Dr. Smythe, and Dr. Galley. They rotate through, and every
To the
month
foot
one of
clinic.
them
They're all
comes to the
awesome,
foot
too.
clinic.
Okay.
And Tracy sees 2 days a week foot clinic patients, so people that have ulcers or
Is it
need some
diabetic
offloading.
neuropathy?
Yes.
Yes,
Like so
diabetic.
that would be your tingling, numbness,
The nerve
Yes.
damage.
the nerve damage from diabetes.
Yes.
Yes.
And
Once it's
they
there.
have lack of sensation. So sometimes if you don't wear proper footwear, if you step on something, you know, we had a case one time that somebody had stepped on something and they didn't feel it. It was a nail in their foot.
didn't know.
So there's many
Infection.
things that can happen. Infection sets in, and you know, if you're not inspecting your feet on a regular basis, these things can get away. You don't start off with an amputation right away. It starts off with a small sore that opens and maybe gets infected and things like that.
And with
So
blood sugars being high, it doesn't heal as quick. So the more we can get their blood sugars controlled, the more the wound heals.
Right.
I'm
so
scared
Tracy
of
is part of the clinic now
the
too.
blindness part really terrifies me. So
Yes.
where do you have to get to reach that blind level?
So people can go to their optometrist on a regular basis at least every 2 years. Every 1 to 2 years, it's recommended that they go and have an eye exam, and they actually look in behind the eye to see if there's any bleeding or anything damage in behind there. We also get some of our patients will be referred to the ophthalmologist as well. That will see somebody, but you need a doctor's referral for that. Yeah.
Do you what's the ratio of men to women with diabetes? Is it not, it doesn't distinguish itself? It's
No,
The
I
same?
know that this year
This
for
year, the theme for the Diabetes Month, there's always a theme every year. So this year,
it was women and diabetes was the worldwide theme for diabetes was women ensuring access for women, and it says that there's 199 million people, women worldwide, that have diabetes. Just
Really?
Oh
Yes.
my land.
yeah.
Oh my
That is
Are there
amazing.
signs and symptoms for the women different than they would be for men?
No, they're very
No.
similar. The
Okay.
same symptoms for both
That's astonishing.
You know?
199 million women.
worldwide that have diabetes.
That's
We're so blessed to have your clinic in this area and educators such as yourself with that number coming out.
Oh,
And
yes.
4,000, like you said, you're treating just
Yes,
within
and
our...
we still have a lot of unknown patients. There's still a lot of
Yeah.
patients walking out there not even knowing, because a lot of them will only know when they go for blood work or they start having the signs and symptoms.
Right.
And there may be
Exactly.
people that we don't even see in the
Yes.
Miramichi area that
And the
don't come to our
doctors,
clinic.
the
you know,
doctors
they
are
see-
covering themselves, yeah.
Yeah. Is there one piece of information or advice that you would like to share before we're all done with our show today?
I guess the biggest thing is just to make sure that you get accredited information. So if you're going to get any information on diabetes, to make sure that you get it from a reputable source. So for
I mean,
ourselves,
not to Google it?
Dr. Google.
as certified diabetes educator, we're trained and we write an exam to be a certified
Yes.
diabetes educator.
Oh.
And then we have certifications for insulin adjustments,
Yes,
for,
as we do,
for
yeah.
insulin pumps, we're certified for those as well. For the pediatric gestational, we get certified for all those things.
And
to
it
adjust
doesn't
them.
cost
up to
anything
date
to
with the
call you and
information.
get that information?
Yeah.
And that's why the doctors too are referring to us, because we keep up to date with the information.
So when you get information from the local Tim Hortons or from a friend or whatever, that's
Or
not
to
always
Google.
the best information.
Right.
So if you want to get information, the Canadian Diabetes Association is
Right.
your best source, or American Diabetes Association. Those are two websites. They're ginormous in size. It's hard to find information, but if you have any questions, you can always contact us at the clinic.
At
So
the clinic,
tell us
yes.
again the clinic's number and location.
Yeah, so we're located in Chatham at the AC Blanchard building,
Right.
and it's 10 Hotel Deer Street, and it's 627-7500 is our number.
Okay, 7,500.
Yeah.
Great,
Oh,
No,
thank
we're
you so
blessed
much.
to have you in the community doing what you're doing and helping cure this terrible disease and
Yes.
preventing it.
Yes, but the prevention is what we're doing.
Key.
Yes.
Exactly.
amazing.
To
It's
get
been
well,
very
knowledge is power, right?
Right on.
Exactly. We want to thank you, Sarah, and thank you, Francisca, for joining us today and giving us all this great, valuable information. And to all our viewers, definitely check them out. Give them a call if you have any information whatsoever, questions about it, or you think, or maybe, definitely go there and get the information that you're looking for. And don't Google it.
No, Dr. Google. No, Dr. Google.
Exactly.
A lot of information
Thanks
we
so much
gathered.
for joining us here at Have a Chat. Have a great day, and we'll see you again next week. Thanks.